Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. We got some really good topics for you today. First off, some brand new breast cancer screening updates. You're going to want to hear this one. Then, women with 3 breasts, is that really a thing? We're going to talk about it. And then finally, Sarah's going to go over all the fashion at the Met Gala, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, as always, is the amazing Sarah.
Hi.
Hi, amazing Sarah.
Hi.
In the box, subbing in for Travis, we got Emilio. Emilio, can you say hi?
Hey everyone, how's it going?
Hey, thanks, buddy. So, all right, it's Friday again. Everybody having a good week? You having a good week, Sarah?
Yes.
Staying busy? Anything
Yeah.
exciting on the horizon for you?
All my exciting stuff happens at the end of the month. I get to go to Mexico, and then I get to go to the Grand Canyon.
Wow, I knew you were going to the Grand Canyon, which is totally awesome. I definitely want to do that. What, you going on vacation to Mexico, or?
Like a girls' trip.
Oh, girls trip, awesome. Yeah, my wife.
It'll be a good time.
My wife does a girls trip every year, which I think is great. She still hangs out with her friends from growing up.
Yeah.
Yeah, college, high school. Yeah, so that's nice. Where are you guys going to Mexico?
We are going to Tulum.
Tulum.
Yes.
Oh wow.
So like an
So this is
hour
like an
south
adventure. So this is not like a lay on the beach vacation. This is like.
No, it's like a resort.
Oh, it is.
Yeah.
I always think of Tulum as like, isn't that the ruins, or am I?
There are some of those.
But it's also like a resort town, I guess.
Those water holes. What are they called?
Oh,
Sorry, my phone
sinkholes or
keeps
something?
going off. No, they're called. What are they called?
I don't know. It's just like
They're
pool.
like old. It's like an old well.
Oh, so like hot springs or something? I am not familiar.
What they're called?
I'm gonna have to look it up.
I was like about to say quinceañera, but that's not.
No, I don't think that's it.
That's a kid's birthday. No, it's cenotes.
Oh, okay.
That's what they're called.
And so, what do you like swim in them, or?
Yeah, you just go in light. It's kind of like a natural spring, like you know
I
how
gotcha.
like the
Yeah.
blue holes that we have here.
Yes, that's what I was thinking.
It's pretty much like
Okay, cool.
that there. But I
So you
think
guys
they
going
use those.
specifically for that, or
No, just for
the girls trip?
because it's Mexico,
Nice.
and you can just wake up and drink a margarita,
Yeah.
or mimosa, and not feel weird about it.
That's nice.
That's
Awesome.
what I'm gonna do as soon as I get into the airport.
Yeah.
Mimosas, even
Oh,
though my
yeah.
flight's at 8 o'clock in the morning.
I mean, that's mimosas are made for in the
Yeah.
morning. I mean, I think you're on the right track.
Yeah.
That's pretty awesome. Yeah, we're thinking about where we're gonna do. We always go on vacation with the family in the summer. We're actually thinking of doing something. We usually go to the beach. That's usually
Yeah.
our go-to. We're thinking about maybe doing one of those Alaska cruises just to do something different.
My mom and dad went on one. They
Yeah.
had fun.
Yeah, I did one when I was a kid, and it was cool. But yeah, I don't know. We're still kind of planning our summer. We're also looking to see if there's any good music festivals, because we like to go to music and stuff. But
Yeah, I'm sure there are.
we've been kind of slacking this year and planning vacation.
You've been busy though.
It has been busy. It's
with
been super
your
busy. Things are maybe
opening
like
the new part of your
Yeah,
business.
yeah, the new business opened, and so yeah, it's been kind of crazy. I'm taking a lot more trauma call these days, so it's been kind of wild. But I don't know. You got to make time to relax
Yeah.
and go on vacation. So
Balance.
that's right. Balance. All work and no play makes Bruce a dull boy. All right, let's jump into some segments. So first off, this first segment is actually very, very important because it involves breast cancer, which obviously is a very big topic here in the United States and across the whole world, in fact. And this one is an important update to the guidelines for breast cancer screening. So this past week, the U.S. Preventative Services Task Force, USPSTF, which I think they should have come up with a better name because that's like super long, I can barely remember it, finalized some new recommendations for breast cancer screening.
Okay.
And so the USPSTF is one of the major organizations that makes cancer screening recommendations. They're one of the bigger ones. There's a few out there that do both breast cancer and other type of cancer recommendations. And all of these people, all of these organizations are looking at research on the topic to determine, okay, what is the recommendation for this particular cancer as far as screening and whatnot. And so from 2009 until now, the USPSTF had been recommending that for people with average risk of breast cancer, so not people with very high risk, but just your average run-of-the-mill woman,
Right.
should get mammograms every other year starting at age 50. Okay? So that's the important thing, 50. So now, after reviewing more recent literature, the USPSTF is recommending that women start mammograms at 40. So they've dropped it a whole 10 years. And to be fair, a lot of organizations had already kind of come to that conclusion that either women at 40 should consider it or women at 40 should talk to their doctor. And now the pendulum is shifting a bit towards that at 40 all women should get mammograms. Of note, they didn't change the frequency because that's also up for debate, is how often should you get your mammograms? Should you do them yearly, which is what a lot of people recommend, or should you do them every other year?
I'm sure it has to do with like when your relatives have history of breast cancer.
For
and
sure.
That determines when your doctor's like, okay, let's start this.
Yeah, absolutely. I mean, definitely for people that have a significant family history, these guidelines change.
Yeah, so my grandmother had breast cancer.
Did she get it when she was
just
older or younger?
Older.
Older, okay.
Yeah.
So that, if she's the only one, that probably would still put you in the average risk category. Now, if she had gotten it at
Early.
45,
Yeah.
or if she'd, gotten it, but also had a sister that got it, and then you maybe got an aunt that got it, then that would be notable, and you would probably be in a little bit higher risk. And people probably wonder, okay, so why is there not a consensus for this?
Yeah.
Well, it's because there's actually several groups out there that are, looking at this data, and everybody interprets data differently, and so, it's hard to get, two people to agree on something. And here you got multiple groups. There's like 6 or 7 organizations that make these recommendations, and, you got multiple organizations with multiple people in them looking at data and trying to come up with, okay, this is what we recommend. And so, historically, it's been a little, controversial about when screening would start. And there's a reason for that, because, as much as screenings are an amazing, wonderful thing that people should do, there are downsides to it, right? Because if more people are getting screened, there is the risk that somebody gets a false positive, which means, the screening looks at something and says, hey, this is a potential issue, you need to get this checked out, and they end up getting another procedure. So you have to kind of weigh that risk of, false positive versus the benefit.
Right.
And so, historically, it'd been kind of older patients that would start getting these screening mammograms, and now the consensus is shifting more towards younger, 40 years old. We just talked about this, I think, in the last 2 episodes about young people getting cancer. We talked about Kate Middleton, which we still don't know what type of cancer she has, and then the week before we talked about just the overall increasing number of young people. And when I say young with cancer, I mean 40s, or even younger than that, getting cancer these days, which is
I wonder if it's a percentage, not just like just from the technology.
Like we're finding more because we're doing more?
Yeah. I remember whenever I
that's
had Avery and they were like, looking at her through those.
The ultrasound?
Yeah, and they were like, oh, we see something. They're like, don't worry though, we've just, we see things different. Like, we see new things all the time because this technology is so new. But it scared the crap out of me.
Really? Yeah.
And they sent me to like a specialist to make sure that there was nothing wrong.
Yeah, and that's a
I was
classic example of how screening stuff can potentially have a downside, right? I mean, in your case, I guess it didn't have like a true downside because nothing bad happened, but it caused you anxiety, you had to go to another doctor.
Yeah.
And so, that's the whole risk-benefit thing when you talk about screening. And fortunately for you, it all turned out great. But that's why there's a little bit of controversy regarding these screenings for different cancers.
What does it look like for whenever like you get like your normal yearly women's checkup where they just like touch?
Yeah, so there's
Does that even do anything? I know my doctor's always
It's not
like,
great.
okay, everything feels good. And
So
I'm like, cool.
the general consensus for breast screening exams, meaning actual physical exam, I mean it's a little bit controversial because there's a couple things about that. One, you want to diagnose breast cancer early, and when it gets to the point that you can feel the mass, like it's not early.
Yeah.
The advantage of a mammogram is it can pick up breast cancers when it's literally just individual like cell clumps. You would never feel that.
Yeah.
And kind of jumping ahead to just my kind of thoughts on this as a plastic surgeon, people would probably be like, oh, why is a plastic surgeon weighing on breast cancer? Well, I actually see a ton of breast cancer patients because I do reconstruction for breast cancer.
Yeah.
And not only that, like I work with multiple doctors, breast cancer doctors, that are sending me patients. So no, I'm not the one that's actually treating it, but I see breast cancer all the time and have for many, many years while I've been doing this. And so, my thoughts on this is that I think starting at 40 is absolutely a great idea. And I agree with the criticism that this task force, the USPSTF, didn't go to annual because getting a mammogram, I've never had to get a mammogram myself. I know that it can be uncomfortable for women, but getting a mammogram overall is a fairly non-invasive test, and it can absolutely save your life.
Yeah, I agree.
Having seen so many women with breast cancer, I fortunately have seen women that didn't win their fight with breast cancer, and across the board, the women that have these worse outcomes detected their cancer when it was more advanced.
Yeah.
And a mammogram can absolutely pick these up when they're very, very early. And, as I said, breast cancer is 100% curable when it's caught early, but when it's caught late, it is very problematic. And, and breast cancer is unfortunately very, very prevalent, both in the world and in our society. I think most people have heard the statistic that 1 out of 8 women in their lifetime will have breast cancer. That's like 13%. That's a significant amount. In the United States, outside of skin cancer, breast cancer is the most common cancer diagnosis in women, and it's the second highest cause of cancer mortality for women.
Yeah.
So, you have a cancer that is very prevalent, and you have a cancer that is 100% curable when caught early. To me, the logic is clear. Early screening is good.
Yeah, for sure.
So, and you kind of were talking about some of the risk factors, or we're kind of diving into it. I think a lot of people know the risk factors, but it's definitely worth going over just to kind of solidify it. So, of course, risk factors for breast cancer, being a woman, and that sounds silly, but men can get breast cancer. Yeah. It's exceedingly rare, but it does happen.
Why does it happen? I'm like, why does it happen? Is it
in
just
men?
from why does it happen in females? Is it just from fat tissue? Is it easier
for
cancer
just
to
that,
grow or something?
It's just that the cancer is specific to the cells that make up breast or mammary tissue.
Okay.
And so, most men don't have, when, we in the womb delineate between man and woman, the mammary glands typically don't develop in men.
Yeah.
And so they don't have those cells that are the ones that actually get the cancer, because the cancer actually arises either in the ducts, basically the tubes that bring the milk out, or the actual lobule where the milk's produced.
Yeah.
And so, if men don't have those, they're not going to get cancer. Same way, testicular cancer is rare in women.
Yeah.
Can it, potentially happen if there's, some sort of issue in the, gestation period?
Yeah.
You do get people that have, characteristics of men and women. Yeah, sure, it can happen, but it's, exceedingly rare.
I'm pretty sure breastfeeding diminishes your chances of getting.
You're very smart. You're absolutely right. So risk factors. I'm going to say that one. Yeah, that's exactly right. So risk factors: being a woman, number one. Age. Even though we talk about the fact that breast cancer is happening more frequently in young women, age is a factor. The older you get, the more your risk goes up.
Sure.
You said one that's very important: family history. If you have a strong family history of people getting breast cancer, also the age they get it is important, then that's a risk factor. Genetics, we've talked about BRCA in the past. BRCA is basically a acronym for a genetic issue with how our bodies deal with cancer cells, or cell repair. And so, people with BRCA are much, much higher risk.
I think Angelina Jolie had
I think
her.
Angelina Jolie was BRCA positive.
She got
Yeah.
hers.
Yeah, so if you're
taken off.
BRCA positive, like the right thing to do is to get a prophylactic mastectomy. Because unfortunately with BRCA patients, their risk of breast cancer is extremely high of getting at a young age and extremely aggressive cancers. So absolutely BRCA patients should consider prophylactic mastectomies. Personal history, if you had a breast cancer once and you got it taken care of, your risk of breast cancer is much higher moving forward. That's why so many people opt for mastectomy versus just taking the little individual lump of cancer out.
Yeah.
Early menstruation, so we're getting kind of some things you talked about. If you have early menstruation younger than 12, it's a higher risk. Late menopause,
Okay.
so if you go through menopause after 55, that's a higher risk. No children or breastfeeding, that's the one you were talking about. History of hormone replacement therapy, alcohol use, strong alcohol use, and obesity are also higher risks. Which, you wonder why more women are getting at a younger age. If you look at the data, like we are as a society, drinking quite a bit, and also
And not having children till later.
That's true. That's also true. And then also we're, as a whole, heavier than we used to be.
For sure.
The rate of obesity is going up like,
Eating all those processed things.
I know, going up steadily. And so I think that might be one of the reasons, because, it's like, okay, well, if the rate of obesity, goes up 20% over 10 years, I mean, that is adding a risk factor to those cancers where it is a risk.
Yeah.
So, but yeah, I thought this was a good update to the breast cancer recommendations. And like I said, I don't treat cancer personally, but I have so many patients that are going through it because of the fact that I do breast reconstruction. And, the one thing I've found is that breast cancer is absolutely curable, but you have to catch it early.
Yeah.
And how do you catch it early? It's not by doing breast exams. I mean, that is a good thing, so I'm not at all telling people not to do self-breast exams, because better late than never, right? I mean, if you haven't got your mammograms at all, and you catch a cancer when you can just barely feel it, that's better than letting it grow very large, because your treatment's going to be easier. But mammograms are key. I mean, they pick up cancers when they're very, very early, and those are the cancers that can be cured. So,
Yeah.
So I think this is a good update. And like I said, I do believe that women should get them annually, and I'm not alone. There's a lot of people that think that.
Yeah, I don't see why not.
Yeah, I know.
How often do you get like colonoscopies and stuff like that?
That's every 5 to 10.
I hope so.
I just got one, so I think I'm good for a while. I know I'm getting old, man. I'm getting up into the age where I'm having to do these cancer screenings. I guess, what do they say? Get old or die. I guess I'll always take get old over dying.
Yeah.
So, but yeah. So important information. I think that it's a good thing that they updated this, and
Yes.
Hopefully it will mean more people are cured of breast cancer. Because I think, if I was looking at the data, I think it's close to 50,000 women a year die from breast cancer in the United States. It's a significant number. So.
It's a lot.
All right, moving on to the next segment, which is kind of related, but
Silly.
absolutely
Sounds
not
silly.
really. It sounds silly, but it's a real thing. So, women with 3 breasts, is this a real thing? Do you recognize?
I remember that picture.
You remember the picture? Yeah, when I was thinking about this segment, I, of course, was thinking of the movie Total Recall, which they had one in the 90s, and it had this kind of memorable scene. It's sci-fi where this woman had 3 breasts, and so that's the I guess the reboot. So did you know that this is a thing? Having more than 2 breasts?
Like genetically?
Yeah, well, just like in general.
Oh, no.
You didn't? Okay, well, see, that's why I thought this would be a good segment. In the past month, believe it or not, I've operated on 2 different women for removal of 3rd breasts.
Really?
Absolutely, yeah. Now, that's a pretty high number. I do these cases periodically where people will have extra breasts, and I'll remove them. But doing 2 in a month is kind of, that's more than average. I would say I do a few a year, maybe one every 3.
I'm like, did they know each other?
No.
Recommendation.
Yeah, so, I mean, my practice is very heavily weighted towards breast surgery. That's
Yes.
just kind of what I'm known for doing. And so because I do so many consults for breast surgery, I see, obviously a ton of women and do tons of breast exams. And I see this all the time. And it's funny, and the reason I thought about doing this as a segment, because one, I've done 2 of these surgeries in the last month, but both patients came in not knowing what they had. They didn't realize that this was a thing. and they just thought they had something unusual happening to them. And I was like, oh, well, I guess maybe, to me, it's like common knowledge. Yeah, women can have more than 2 breasts, but I think the average people don't necessarily know that. And I was talking to him, he's like, yeah, I didn't know this was a thing either. So that's why we're doing a segment about it.
Okay.
So yeah, this is actually a pretty common thing, and it all arises because of our embryologic development in the womb. So in the 5th week of gestation, the mammary ridges form on the ventral, so that's like the stomach side of us as fetuses. And for men, these pathways kick in and those things completely go away. In women, I shouldn't say they completely go away because men do have nipple areolas, but they don't necessarily have breast tissue.
Yes.
In humans, the way it works is those spots regress except for the 2 on the chest. And so I want to throw up that next pic, Emilio. Yeah, so this is the milk line, and that shows where human beings could potentially have either breast or a nipple areola, one or the other, or sometimes both. And yeah, a lot of people don't realize that embryologically we're very similar to something like a dog. I mean, everyone. I use a dog as an example because everyone's seen a.
So the circles on there are potentially where you could have nipples.
Nipple areola or breast tissue, and I'll talk about what I commonly see. But yes.
Interesting.
Yeah, so that's the milk line, and so theoretically, a human can have breast tissue or nipple areola anywhere along those 2 lines. Yeah, I put smiley. I didn't know if YouTube would get mad at us because there was a picture of an areola there. I was like, oh, better safe than sorry. So I put the smiley faces up there.
So cute.
I know. So the risk of this is not high at all. It's actually fairly rare, but it's common enough that a lot of people have it. So there's a stated risk of 1 to 5%.
Okay.
So 1 to 5% chance of you having either accessory breast tissue along those lines or a nipple areola, or both.
Okay.
It's more common to have one or the other.
I've heard of people having like a 3rd nipple.
Yeah, there you go.
But
Supernumerary
not like
nipples. Yeah, but not breast tissue.
Yeah.
Yeah. So going back to the cases I did. So one of the cases I did was a large amount of breast tissue in the axilla, because that's where
What's that?
Oh, sorry, the armpit. Yeah,
Okay.
you got to check me. Sometimes I use doctor words and I forget that it's not.
Okay. I should have known what that was as soon as you lifted up your arm. I was like, oh.
Yeah, excellent. So the most common place that I see accessory breast tissue is the armpit. Mm-hmm. I see that literally all the time. I mean,
I have little, I always call them chicken nuggets.
I mean, it could be that you have a little tiny bit of accessory breast tissue, or it's a very common area for people, especially with arms down, to get like a little bulge,
Yeah.
And so, yeah, I mean, it could actually be accessory breast tissue.
I have excess boobs.
And I actually learned something when I was prepping for this segment, which I found insanely interesting. I found a study. Throw up that study, Amelia, can you? Yeah. So basically, long story short, this was a study looking at these vestigial breast mounds in normal people. And so, kind of cutting to the chase of this study found that even in patients who don't necessarily have accessory breasts, the fat tissue along that milk line resembles breast tissue more than we previously thought. And why that's important is because that tissue is much less resistant to diet and exercise. And so that's why, or it's thought that maybe that's why people tend to have fat tissue on their abdomen more than in other areas.
For females
specifically,
Yeah.
because that tissue, that fat tissue, is actually different than the fat tissue in other parts of our bodies. Even if it's not forming a breast, embryologically it's slightly different. It means it's slightly more resistant to diet and exercise.
Yeah, I know on women, like the biggest part for women to lose weight is like right there.
Yeah, across the bottom. Yeah.
Yeah. Like right below the belly button, and that's where that picture was.
Yeah.
Where those little.
I didn't
dots
know
were.
that fat
Makes
tissue.
sense. I always thought it was just to protect our ovaries and.
Maybe, I don't know. I mean,
all
who knows how these things.
All the baby making equipment that we have.
Who knows how all these things develop? But anyway, so the accessory breast tissue, it can vary a lot in size and appearance. I mean, I've seen people that come in that literally, and I got a couple of pictures I'm going to show in a minute, that almost look like they have a third breast in their armpit.
Because it's so big.
Because it's so big.
I always thought I had more because of me just having more arm muscles.
Yeah.
Just like more.
Well, too, for you, because you work out so much, like your pectoralis muscle, like your chest muscle, I'm sure is much bigger than the average woman. And that's going to kind of push everything forward. So, I mean, and that pectoralis muscle has a very big ridge here right by the axillaris. So that might be all that you're seeing is the fact that, yeah, you're kind of fit. And so when you have big muscles, it kind of pushes everything forward. Yeah. So as far as these accessory breast tissues or nipples, they're usually very benign and overall asymptomatic. However, this tissue does fluctuate like breast tissue, which meaning hormonal shifts can change it. So puberty, your menstrual cycle, pregnancy, this tissue can respond. And just like some people get tenderness in the breast with their cycle, you can actually get tenderness in these accessory breasts with the cycle. And it's also susceptible to the pathology that people will see in their regular breasts. So things like breast cysts, fibroadenomas, which are just benign tumors, and even theoretically breast cancer.
Yeah,
now,
I was about to ask. I was like, do people with this issue have
it's theoretically
increased risk?
possible. I personally have never seen it, and I haven't actually even seen like papers about it. But I mean, it can exist. I mean, if I dug deep enough, I'm sure I could find case study of somebody that got breast cancer and accessory breast. I think it's exceedingly rare. Accessory breast tissue is not common in and of itself, and then for one of those to actually get breast cancer, I mean, can it happen? Sure. I mean, anything's possible. Is it something that people need to worry about? Probably not. The supernumerary nipple area complexes, however, tend to be more benign. They don't necessarily fluctuate with hormones, so usually it'll just be there, and it's more of like a cosmetic issue.
Yeah.
The last one I got, somebody came in, was referred to me, and they're like, yeah, they have this like mass underneath their breast, and it looked like a really tiny nipple areola, but that's exactly what it was. And so I was like, yeah, this is a supernumerary nipple, and of course they were like, I didn't even know that's a thing. I was like, yeah, I see them pretty commonly. And so when I went to take that one out, there was actually breast tissue behind it. So it was actually a really, really tiny. I mean, when I say tiny, it was like the breast tissue was probably a spot like this, and then the nipple areola was probably like smaller than a dime on top of it. So
interesting.
Yeah, pretty interesting stuff. So if you have this, do you have to get it treated? No.
How do you remove excess?
So that's a great question. I'm getting
because I whenever I got mine done a long time ago,
so
he tried to
to remove it. So
but I think mine's just
because if it's a nipple areola, you just cut it out. That's the only way to get rid of it. If it's breast tissue,
is it like liposuction?
Some people would try to lipo it. I found that the problem with liposuction accessory breast tissue, because I have done that in the past. The issue is that when you get that accessory breast tissue, it stretches out your skin, and if you just lipo it, you can get rid of the bulk of it, but the skin will be there, and people don't like that. So I think direct excision is your best option if it's of any size whatsoever. Because you can excise the breast tissue and you can excise the extra skin, and yes, you do get like a little faint scar, but I mean they usually heal up nicely to the point that they're not really noticeable. Plus, being in the armpit, it's not in a super visible place. But so anyway, I got some pictures. I actually didn't have any of my own. I found these online. There's actually a lot of pictures of this. This is a classic accessory breast.
Yeah, I don't have that.
Yeah. So I mean, you look at that, and yet no, it doesn't.
It looks like she has her lymph nodes in her armpit are inflamed.
That would be a huge lymph node. That would be problematic. Yeah. But yeah, no, that's a classic accessory breast. Yeah, so there's another one. There's a before and after that was just
interesting.
So you can see it there in the armpit, and then afterwards, that's a pretty fresh scar, but you can see that the contour is much better. And then, yeah, there's another one, pretty classic. It almost looks like a little, I don't know, a fold of tissue in the armpit. And people, most people don't realize that it's actually breast tissue. And it all goes back to the fact that, I mean, I don't want to get into a philosophical debate about where we come from, but
we're all mammals.
That we're all mammals, right? And mammals typically have multiple breasts, or many do, and it's kind of an embryologic remnant of that.
Nice.
Interesting stuff, right?
Science.
Science for the win. Science. Yeah. All right. Now, moving away from science to one of my other favorite topics is fashion. So,
Yeah.
Sarah, the Met Gala, were you impressed with all the outfits?
Yeah, I liked it. As I've gotten older, I've kind of like, it's almost like I'm just like, why are all these people getting dressed up and spending all this money?
Because it's fun.
Yeah, I know, but at the same time, I'm like, but also I like all their clothes.
Oh my gosh, I love like those events. I'd love to go to something like that. I mean,
Yeah.
I mean, obviously I'm not like a famous person, but if I was, man, I would totally dig going to those events because you get to like think about what you're gonna wear. I mean, I love that kind of stuff. I know that's weird, not all guys like that.
But that's cool. I think it's for a good cause. The Met Gala, just because it's for it's like they're raising money for art.
For the arts and I mean,
And then-
obviously it's a good thing.
But yeah. And then it was the theme was garden, like not secret garden, something garden.
Yes, I heard that theme. Yeah.
Some summer in the garden or time of the garden, something garden of time.
The Garden of Time.
Yes, that's what the theme was.
So I guess everyone's planning their outfits to have some sort of
Garden,
correlation
floral theme. Yeah, so there
Yeah.
was a lot of floral, which
Okay.
is cool, which is on theme point for
So you-
spring. So I made a collection of things. The first part is I picked all the dresses that I would wear first.
Yeah,
'Cause-
obviously.
Because I thought that would be cute.
So Sarah's faves?
Yeah, and then you can go and change it. So yeah, these were my favorite ones. Jennifer Lopez is right in the middle. I do not know who the two girls on the end
Isn't
are.
that Anne Hathaway on the left?
No, that's
not-
a model. That's some like a
Oh.
Hadid maybe. It's one of those models that hangs
Okay.
out with them. And then the other girl is like a plus size model.
Okay, so the two on the end are models, and we got J-Lo in the middle.
Yeah.
I love the dress on the left. I mean, of course, and we've talked about.
There's so many. There were so many see-through.
Yeah.
Diamond.
Yeah, and we talked about that when we
rhinestone
did spring
things.
fashion that was
Yeah.
in. Yeah, and you can see
It's
that here.
everywhere. Yeah.
I love that dress on the left. That is an absolutely fabulous dress.
Yeah, it's super cute. Okay, the next one. So these are all the Kardashians that were there. They're
All
my
right.
favorite. But yeah, I loved all of their outfits. People gave Kim a bunch of crap because of her little grandpa sweater she's wearing, but she was mimicking a girl from a runway show.
Oh, okay.
So she was trying to be very, like, she was mimicking some type of fashion shoot from a long time ago, like in Vogue.
Oh, okay, so she was mimicking like a throwback kind of style. I think that's cool. I mean, I love
but
throwback stuff.
But when she was interviewed, she goes, "Yeah, I was just getting ready, and I just threw on my boyfriend's sweater." And people were like, "You have a boyfriend?" And she doesn't, I don't think.
And she probably just didn't throw that on. That was
Yeah,
all
no,
like,
it was part of the whole thing. But the way she acted was kind of
yeah,
silly.
so bad
but-
delivery on her part.
Yeah, but I thought the Jenners looked really pretty too.
Yeah, those are nice dresses.
Yeah, super cute. And then I really liked the two girls on the end. The one on the left side, she's wearing like a wooden corset.
Wow,
Yeah, I thought that was really cool.
that is cool.
And I would totally wear that.
Very asymmetric too.
Yeah.
Especially like the lower parts of that.
Yeah, it's very goddess. She looks like a little Greek garden goddess person.
Oh, I get it.
And so does the other girl.
Yeah.
To me, she looks like very like Greek Roman, like she should
Yeah.
be in a garden, like as
Yeah,
a statue.
No, I love that.
And then the one in the middle is just like simple and pretty.
Simple, elegant.
Yeah. And then these are some of the more, well, I guess the two are the darker ones that I liked. The one on the right, hers looks like a butterfly.
Oh, it does, yeah.
yeah,
It looks
so-
like a monarch butterfly's wings.
Yeah, it's very pretty. And then
Love
the
that.
girl in the middle, she's actually from Bridgerton. I forget her name, but she's an actress. And
Okay.
she has I just love that dress too. And then obviously that really pretty white.
Flowing white, it almost looks
yeah,
like
with all
lace.
it's like lace see-through, all the things.
That was very popular.
And honestly, it's just really striking with her skin tone. So.
Yeah, it does. It's a very big contrast.
And then these are some of my other favorites. I think the one in the middle was actually designed by Victoria Beckham. Her
really?
fashion
I didn't know she was
line,
doing that.
yeah. So it's very pretty. And then I really liked the one on the left. I love those roses and just the way it's
Florals,
shaped.
yeah.
Yeah. And then the one on the right is probably my very favorite. I should have brought the video, but like there's like this mechanical thing on her back and the sleeves on her arm look like butterflies, and when it moves, It was
You're
like
kidding.
moving. It was so pretty, and the behind, what it looks like from behind, is so pretty. It like
Oh wow, I'm gonna have to look it up.
it's like
who was
rolled.
that? Do you know?
Nobody knew who it was.
Oh,
They were
really?
like this mystery girl, but they found out who she was, and that she's all over the internet now.
Oh, is she?
Yeah, she's a model,
Uh-huh.
and I think she just wasn't like well known.
Now she
Because
is.
anybody can buy a ticket
Oh,
to
really?
go there. I mean, I guess you can be invited,
Uh-huh.
but you have to buy a ticket.
Oh,
so
I see.
somehow, maybe like that designer that she was wearing was invited, and they were like, she's
that
gonna
makes
wear
sense.
it
Yeah.
or something. I don't know. But yeah, those were my favorite ones. Those are like dresses that I would actually wear. Like if I was going,
Mm-hmm.
that's what I would wear. And then according to Vogue and all the other fashion outlets, these are the best, weirdest, and worst. I think I'm going to show the
I think
worst.
I think weirdest is first. Is it weirdest or worst?
What's the worst?
Oh, worst. Okay.
The worst.
I was trying to remember when we were uploading these. Yeah. Okay,
Yeah.
let's see the worst.
The worst. So these were the top 3 worst.
Is that a bath towel?
Yes, Doja Cat has been doing some weird stuff in her Doja Cat things. She's just been like, she went to a museum, like the prequel to this, wearing literally a bed sheet and a thong
Okay.
with this creepy
I
man.
have to say,
with this creepy man next to her.
I hate all of those dresses.
Yeah, they look awful.
Like the girl on the right looks like.
That's not a girl.
Oh, it's not.
No,
Oh.
I think pretty sure that's a them, but
Oh.
yeah, or it's a. I think
Okay.
it's,
Well, whatever. I hate it.
yeah, I think
I
it's a
don't-
male.
it looks like
but yeah.
some sort of.
He's a male.
It looks like some sort of like nun outfit from like the 50s.
I feel like that's what you would see in your nightmares. Some type of like nightmarish doll standing in your hallway
Right.
with like your dog, and it has like like you're like, what are you doing here? Leave.
Yeah, I don't like that one at all.
Yeah.
The bathrobe, not a big fan of either. And then that dress in the middle.
It's just not flattering.
No, it's not. It's like a parachute got wrapped around her.
It looks like a bell. Some type
Yeah.
of-
So I'm gonna agree with you on
Those were my top. There was a bunch of them, but those were my top 3.
those. Have to be the worst.
They're pretty yuck.
Yeah.
And Doja Cat, the other thing, she wore 2 outfits because she went there with a towel, and then she walked the red carpet with literally a sheet, and it was covered in like oil, and so she just looked like she was just
Like
wet.
motor oil.
No,
Oh,
just
no.
like baby oil. Like she just looked like she was just wet.
I mean, you have to give it up to her that like she's doing things and we're talking about it.
Yeah,
You
she's
know,
just
but-
doing Doja Cat things. She wears weird stuff all the time.
Yeah.
She went on Jimmy Fallon wearing something similar to this, like this,
Yeah.
and something that matched like a skirt that looks like this, but the back of it was literally just a thong. So her butt was just hanging out, and Jimmy Fallon, like she stood up, and Jimmy Fallon was like,
Didn't know what to do.
"What do I do?" But yeah, and then so next we have the weirdest.
Yeah. All right.
So these were the weirdest ones. The left lady is literally.
That looks like a Vegas showgirl.
Yes, I thought that was like, these are like, I guess not weirdest, but like the most like extravagant looking
Elaborate.
ones. Yeah. I mean, it was definitely on point. She's a butterfly.
Yeah.
But it was more like almost a costume and not,
Right.
like.
An outfit.
Yeah. And then I thought Lizzo's outfit was just not it. I just did not like it.
Is there something?
She has something on her head. You can't see it because of that little timer thing we have
Oh
on it.
right. Yeah. Our timer's in the way.
But yeah, it's supposed to look like, symmetrical. Like it's like belled out
Oh,
on
I
the
see.
bottom
Yeah, I
and
can
then
see it
belled
now.
out on the top.
Yeah.
But I just think it looks really silly.
I do like the one on the right. That's almost like a kind
That's
of.
Demi Moore, yeah.
Oh, it's Demi Moore. Oh yeah, it is Demi Moore.
It looks better when she takes that weird thing off.
Yeah.
It like comes off.
Oh, does it?
Yeah.
It looks kind of like what are they? A geisha. Kind of
Yeah.
like geisha look.
Yeah.
I mean, I don't hate it. I
It's
mean,
not bad.
The Met thing, the Met.
It's like
outfits are
either
elaborate, so-
you wear like something pretty or like an
Something
actual
exotic.
dress, or you wear like something crazy.
Yeah.
There was a lot of men. I should have done one specifically about the men. There was a lot of them that were like, oof.
They were out there.
Yeah, one of them looked like straight up like he was wearing like nude color everything, but it was all like diamondy,
Oh.
and like he looked like a Roman, like a god or something, and it was like all like
Oh,
drapey
I think I saw
and
that.
stuff, and I was just like, what's happening? I mean, he looked like he should be like, it looked like a costume, like he was like gonna go out and figure skate or something. That's what it looked like.
Out and figure skate.
It did. It was nice. It was pretty, but it was like a lot.
It was a lot.
Yeah.
All right, and then we got
The worst.
no the best.
No, the best. Okay.
The best.
We already did the worst. So this is the best according to Vogue.
Okay.
So we've got Cardi B with the big black dress that she's wearing. That when I say big,
It was
I'm
huge.
not like the train was literally almost the size of this freaking studio. It was humongous.
It looks enormous.
And then in the middle, that is Zendaya, and she actually had two looks, but I just liked this one better.
yeah.
Hers
I like
were
that
very
dress.
high fashion.
Mm-hmm.
So that was cool. And then Lana Del Rey is the one that looks like a tree.
Yeah, the dress is cool.
Yeah, it's different, but those were like the most photographed, like,
Yeah.
ooh. Like, those were the most like celebrated.
I'm gonna have
ones.
to give a special mention. One that you didn't include that I just saw floating around social media was Katy Perry's dress was awesome.
Katy Perry's dress, she wasn't even there. That was AI.
That was fake?
Yes!
Are you serious?
The one that looked like she had like all of these flowers
Yeah,
on her
that was
dress.
fake?
Yes, she
Oh
did not
my
attend.
God, I got duped by AI.
Yeah,
I saw that floating because I like Katy Perry a lot, and so I was flipping through Insta X or something.
I should have mentioned that. Just
And-
put the photo up there, but yeah, that was fake.
Oh, well, the dress was amazing.
So she posted on her Instagram, and her mom goes, "You look so beautiful at the gala," and she goes, "Mom, I'm not there," and she goes, "I know," or like something like AI got you, Mom, or
Oh
something.
my gosh, I can't. Why would someone do a fake of Katy
She's
Perry?
like, "I didn't think you were going to the Met Gala,"
Why would someone take the time to put a fake Katy Perry dress?
just to
See if people fall
cause
for it?
commotion.
I guess I saw it. In fact, I was like, "Oh, dude, Katy Perry's dress is on point." And then when I was uploading the media, I was like, "Oh, Sarah didn't put Katy Perry's dress on there."
Because she wasn't there.
Oh my gosh, I can't believe I got duped by AI. Man, you got to be careful, people.
I know.
Dude, that's insane. Like, how do we believe what's real and what's not anymore?
Can't.
Wild stuff. Well, I love that. Those were amazing dresses.
Yeah.
I appreciate your insight in
Yeah.
all of those. So, all right. I guess that's all the time we have this week. Thank you guys so much for tuning in. We really do appreciate it. Please leave us a comment. Tell us what segments you want us to do, and maybe we'll talk about them next time on Nip Talk. Bye.
Bye.